A warm welcome to all our viewers and thank you for joining Facebook live chat session organized by Aakash Healthcare Super Speciality Hospital, New Delhi. Today, on the 17th of April, as we celebrate World Hemophilia Day, we have the opportunity to be accompanied by one of the leading experts in the field of hematology. Thank you so much, Dr. Roshan Dikshit, Senior Consultant, Hematology and Bone Marrow Transplant.
Hello.
Dr. Roshan comes with an experience of more than a decade in managing benign and malignant hematological conditions with expertise in the procedure of bone marrow transplant. He has worked with many of the premier institutes of India and across the world. In hematology and hematopoietic stem cell transplant, he has special interest in alternate donor transplants, haplo-identical transplants. So, Dr. Roshan, today we shall be discussing about hemophilia, prevention of bleeds. So, what exactly is hemophilia and why is it so important to know about it so that we are celebrating a day out of
So today is World Hemophilia Day, and we have the intent of spreading this knowledge of hemophilia so that we know when to seek help, when to start the treatment, how to prevent bleeds, and help the children and the young adults affected with hemophilia live normal lives. So hemophilia is the most common bleeding disorder, which is usually diagnosed in early infancy and childhood, and it usually presents with bleeding situations. Sometimes it can be a life threatening bleeding, and usually it can be very well managed with administration of clotting factor concentrates. And after we diagnose hemophilia based on the severity of hemophilia, we can put patients on clotting factor prophylaxis so that they can have normal lives without bleeding episodes and they can go on to lead normal, healthy lifestyles.
Right. Dr. Roshan, when does a person suspect that they are having a bleeding disorder? Are there any usual signs and symptoms? What are they?
So usually the bleeding disorders like hemophilia, the most common variety being hemophilia A or the clotting factor deficiency of factor 8, is usually diagnosed in early infancy. So usually it is noticed by the parents.
Yeah.
So it comes to the medical attention when the child starts walking or mobilizing, in which he will start having bruises and bleeds. So the bruises are usually deep seated, like they occur under the skin and the subcutaneous tissue. They may not be noticeable to the outside. Very rarely, it can be suspected in neonatal period, that means just after birth, when the child may present with a birth trauma, like during a vaginal delivery. The child may present with a swollen head because of the instrumentation during the delivery. He can also have bleeding during procedures like circumcision or during tooth extraction. So these may sometimes prompt the parents to seek medical attention because there is bleeding which is more than what is normal for that procedure.
Right.
So during when the child starts walking, we notice these changes, that is bleeding into the joints, bleeding into the muscles. Sometimes there can be small swellings in the forehead because the child starts playing and gets hit by the head. So those all things come into medical attention, and the parents usually seek attention from the pediatrician, who is the initial diagnostic person who will see these symptoms.
Right. So, Dr. Roshan, since you mentioned that we can see these signs and symptoms usually in a toddler age as well. So, how do we diagnose hemophilia in these babies and other bleeding disorders? Can that be made in such small children?
So once we see these suspicious signs that the patient is bleeding out of proportion to the amount of trauma or is having these unexplained bruises or swellings, we usually do a few blood tests to first see the coagulation parameters, like how the blood is, the bleeding is stopped by the use of clotting factors. So we check for coagulation parameters, and once we see that these parameters are deranged, which usually is the case with hemophilia, then we check for the exact clotting factor deficiency, which is causing these problems. So, as I said, the most common clotting factor deficiency is factor 8. So, once that deficiency is detected by assays, then the management is done by that clotting factor concentrate.
Right. Dr. Roshan, is hemophilia a preventable disorder, and how does the prevention take place in these bleeding episodes?
So, hemophilia by itself is not a preventable disorder. It is actually an inherited disorder and it follows X linked recessive inheritance. So, in layman terms, X-linked recessive means usually mothers would pass on this disease, this genetic disease, to their male children. It is usually not possible for females to have this disease because they have two X chromosomes. And so, one X chromosome, even if it is detected defective, then the other X chromosome will make up for the clotting factors. But usually, males, because they have one X chromosome, so the clotting factor deficiencies can be severe in males. So it is usually passed on as an X-linked recessive trait. So
Right.
coming to your next question, whether the bleeding episodes can be prevented, then to answer that question, it is really difficult because these children are very active at that age. They'll be walking, they'll be roaming around, they'll start to explore games. So, and there can be impact also when they fall or they hit another child. So, rather than preventing the child from doing things normally, we'll have to devise principles of prophylaxis so the child does not have bleeding episodes. So, prophylaxis means administering clotting factors so that the child does not have.
Yeah. Since you're talking about the clotting factors, so should families of these patients having the hemophilia disorder always have this clotting factor with them?
So, families in which the child is affected with severe hemophilia, that is clotting factor levels less than 1%,
Hmm.
they usually are on prophylactic programs in which the patients usually have stocks of these medications at home. And as soon as there is a suspicion of bleed, the patient needs to seek healthcare because these clotting factors are administered intravenously. So, obviously, cannot be administered at home, but it can be administered at any nearby hospital setting. So, to answer your question, the children affected with hemophilia or the young adults, they usually have clotting factors with them, and they should keep supplies with them so that in any suspicion of bleeding, that is to be administered by a healthcare professional.
So, Dr. Roshan, if you can, explain a little bit about the treatment protocols you follow for the bleeding of hemophilias.
So, bleeding of hemophilias are managed in two possible ways. One is when there is an acute bleed, like someone who is having a trauma, like a road traffic accident, or is about to undergo a surgery, in which we'll have to push up the clotting factor levels to an hemostatic level. That is, we push up the level of the clotting factor to a level so that they don't bleed.
Hmm.
So, in that is the acute management. The second management, which is very important in actually infants and young children, toddlers, or young adults, is the prophylaxis. So there are three types of prophylaxis usually done in hemophilia. One is primary prophylaxis. Primary prophylaxis means you start clotting factor prophylaxis even before the child bleeds even once.
Hmm.
The second is secondary prophylaxis. Secondary prophylaxis is usually done after one or two joint bleeds, in which we try to prevent the side effects of bleeding. That's why we institute it at a later stage. And tertiary prophylaxis is when the child already has got complications like arthritis or growth disorder or any other recurrent bleeding problems, and we institute it at a much later stage to prevent further bleeds.
Right. So, Dr. Roshan, since we're celebrating World Hemophilia Day and not many people are aware about this disorder initially, are there any takeaways you would like to give to our viewers today?
So it's very important because it is a benign hematological disorder. It is nowadays very well managed because we have purified, we have concentrates available which are very safe to give. They do not cause inhibitor formation very soon, and it is very well managed in young children. And we need to give prophylaxis to patients with severe hemophilia so that they don't have recurrent joint bleeds or recurrent bleeds and compromise the lifestyle. We treat a lot of hemophilia children with concentrates, and they can go to school, they can play, they can do all their normal activities. So, obviously, access to clotting factor concentrates and access to treatment, as outlined in this Hemophilia Day, is very important for proper healthcare and proper support to these families who are living with this disease.
Yeah, so justifying with the theme access for all. Thank you so much, Dr. Roshan, for your valuable views on this. Thank you